presented by the Education Department of Symmetry. Let's talk about the functional items, those sections G, which is all our M18 items, and the GG items, and how to really look into how to answer them appropriately, and also the comparison or similarities between the two, and where do they actually start to differ from each other, so that you don't want to be trying to make any direct comparisons. So we know within the OASIS itself, there's a lot of different verbiage that all seems to sound like assistance of some type. So let's look at all the different words that are out there and what it really means. So you might even see the word help. So help actually consists of both supervision and assistance. So what is supervision? Well, that's your verbal cues, your prompting, your reminders, your standby says. So hands off. Your assistance, now you're getting physically involved as a clinician. You're touching, you're contact guarding, you're participating in the task in some fashion. So we say, think of help as interfering in the task. If no one interfered, no one said anything, no one did anything, would the patient be able to safely complete the task? Now, really be careful when you're marking independent, especially as start of care, right? Because you give your outcomes nowhere to go but down, which is a possibility with value-based purchasing. So when you're saying someone is independent, that means that the patient is able to consistently complete a given task without assistance of any kind whenever they choose to do that task without any safety concerns. So independent means that the clinician is not needed to ever address this again. The intent for both the M18 items and the GG items is always what can the patient do safely. So assessment of the patient's ability to complete or perform a task safely is inferred in all these codes. Whether it is actually stated or not, always think in the back of your mind, have that little word safely running around. So we want to focus on three key areas when you're assessing these ADLs or IADLs. What can the patient do safely? What assistance, whether it's a device or a human, is needed so that the patient can do that task safely? And what environment, is it the tub, the shower, the bed, the sink, the stairs? What environment is needed for that patient to perform that task safely? There are conditions that can affect someone's ability to do something safely. Do they have chronic pain, dementia, dyskinesia? We have safety issues due to falls risk and functional limitations, such as weakness, increased low back pain, which is constant. How do those J05 items look with the three different levels of pain assessment, whether it be sleep, ADLs, or therapeutic activities? How is their recent history of falls? This might be changing your scores because supervision throughout the activity may actually be their safest performance. Poor balance, fatigue. Let's look at the types of medications that they're on. There's some meds, like your vasoactive meds, it could easily affect their safety. They stand up too fast, they may drop. Not a good thing. And then, of course, decreased endurance or dyspnea with moderate exertion. Again, all these factors, and let your mind wander. Anything that seems like, hey, could that affect someone's safety? Yeah, probably. Do they walk around the house in socks all day on hardwood floors? Maybe not a good idea, right? So just look at all components that may go into someone's ability to perform something safely. So here we show the comparison between the M18 items and the GG items as far as where's really the focus, and what looks similar and where are those differences. So on the M18s on the left side, we say that an assistive device use affects the coding. We're also looking at the ability to access the task location also affects the coding. And coding captures the assistance needed for the majority of the tasks. So what is being done greater than 50% of the time. The GG item coding has activities may be completed either with or without an assistive device. They don't have to use one. If they do use one, it does not affect their coding at all. It's only about human assistance. We're also saying that the ability to access the task location is not considered for the GG items. It is strictly about the completion of the entire task of that GG item. And for these GG items, the coding captures the percent of assistance needed for the entire activities. Whereas in the M18s, remember, we're looking at the majority of tasks. So if they were mod assist for the majority of dressing or something, they're going to be scored on that. But the GGIs we're looking at, okay, what percentage of assistance was needed to complete everything for that task? So there's just, some difference there, but they're key points. These next two slides just show really therapy language, the words, the verbiage that they use, and how that integrates with the GG items. This is a kind of a crosswalk. So if you're seeing what the therapists are saying, this is how that might, or most likely will relate to the GG scoring. So it ranges from all the way, starting at the top, dependent, total assist. At the bottom of this page, we have your min assist. And as you can see, the moderate and min assist actually captures the same code in GG. 03 encompasses both of those levels that therapists would use in their language. Again, on the GG side, we have supervision or touching assistance, your code 04, and that translates out in therapy speak to contact guard or standby assist or verbal cues. So it's either you're touching or you're supervising, your hands off. So both of those situations will be encompassed in that 04. Then we have the setup or cleanup assistance 05. There really is no direct link to that in therapy language. We'll use the same thing, setup or cleanup. And then finally, we have the independent or mod independent, as you'll see therapists use. And mod independent merely means that someone is independent in doing something, but they need a device to help them out, again, for safety purposes. This is the GG item coding key, nothing really spectacular here, nothing new. I just wanted to point out again that the activities may be completed either with or without assistive devices. And I wrote down at the bottom, it says, notice that none of the codes mentions the use of an assistive device. This means that regardless of whether or not the patient uses one, the coding is to be based on the percent of human assistance. What is that helper doing for safety in a task completion? So let's look at two items that people are trying to compare one to the other. How'd you do on the score of that one? So that's how I'll do on this one. It doesn't really work with these two, the M1800 grooming and the GG 0130B, the oral hygiene. And that is because the grooming is looking at washing your face and hands, the hair care, shaving or makeup, teeth or denture care, or fingernail care. What you want to be sure you realize is for the oral hygiene item on the GG side, the only thing they're looking at is teeth or denture care. It's just the oral care. There's nothing about shaving or hair care, washing the face and hands, or fingernail care. There's actually no GG item that covers that. And of course, on the M1800 side, we're looking at the ability to access where that grooming is performed. So if the hand washing is determined to be the majority of tasks, majority of the times, we have to consider where does that hand washing occur and how does the patient do getting there and returning from there. The oral hygiene doesn't care where it happens. That's, task location access is not a consideration. So I would really strongly urge not to try and compare the coding between these two items. Now these items are similar, M1810, your upper body dressing, and the GG 0130F, which is also upper body dressing. They're looking at basically the exact same task. The only difference is when we score the M18 item, we also have to consider the ability of the patient to access where the clothing is stored. So if someone can dress themselves, but they need assistance or they need a device or something to that effect to get to their closet safely or to get to their dresser drawers safely, then they would not be a code 0, they would be a 1 for M1810. So you could be a 1 for M1810 and be an independent, your score of 06 on the GG 0130F. So there could be that, wait a minute, it's not really independent. Well, again, it's because we have to look at their ability to access where the clothing is stored. And if someone's a falls risk, we always have to take that into account when they're up walking around. And also, how do they do when if they are standing and dressing, if they have balance problems? Are they really safe? Are they independent on their own dressing? Or are they sitting down onto the bed, perhaps? They've gotten a way around that, and then they're dressing themselves. So you just have to look at all the things that go into safely. Same again with the lower body dressing items. M1820 and GG0130G are very similar. Where it does differ, though, is that the M1820 item also considers footwear. So that's all part of the lower body dressing items. The GG items have broken footwear out onto their own. That is the H item. So there you might have that difference going on between the scoring just because of that footwear. And of course, there's always that, consider the ability to access where the clothing is stored. So in considering those items we just talked about, we always want to be sure that you realize that there is no requirement to dress in a certain amount of time as long as the patient can dress themselves safely. Okay, it takes them a half hour to get dressed. That's okay, as long as they're doing it in a safe manner. You want to consider documentation regarding the ability to dress. Do they typically sit on the bed and dress, or do they stand while they're dressing? How's their balance? How's their vision? Look at any deficits they may have. Do they require assistance because of that, whether it's by touching or supervision? I could just be, saying something in order to keep someone safe. So again, always a reminder, assistance does not necessarily mean someone has to physically be involved in that task. It could be just supervision or verbal cueing. Let's look at an example. So for M1810, the patient has physician orders to wear a brace on her wrist. The brace must be removed and left off for 15 minutes once every 2 hours during waking hours. Her caregiver must remove the brace and place it back on. The patient needs no further help with upper body dressing. So what is the most appropriate code for M1810? And these, of course, are your choices here. So for this item, there's our question. We would say for M1810, we're actually going to score that as a 3. The patient depends entirely upon another person to dress the upper body. Reminder that devices the patient is ordered to wear, such as a brace, are considered dressing items, even if they're not routinely worn. So for the scenario, the removal and reapplication of the brace multiple times a day represents a majority of the upper body dressing tasks, and the patient is dependent in that task. So this is how we got to that score of M1810 equaling 3, where the verbiage is patient depends entirely upon another person to dress the upper body. I know, you're scratching your head, go, but they're dressing the rest of themselves fine. Again, I understand, and that's the limitations we have with our M18 items. We can tweeze all that out when we get to the GG, and we will. But right now, just understand we're talking about majority of the task, majority of the time, and it comes down to that brace. So now for GG0130F, your upper body dressing, same scenario. We're going to say it's going to be a score of 03, your partial moderate assistance, not dependent like it would have been on the M1810 item. This is partial moderate assistance, because despite that dependence we had in M1810, the patient would not be coded as 01 dependent here. We're going to look at all of the tasks, so all of the dressing tasks, and the percentage of human assistance needed. So for this helper, the helper did less than half the effort, so we're going to code that as 03, which is your partial moderate assistance. The lower body clothing issues. We've talked about M1820, which talks about, obviously includes your undergarments and your slacks as well as footwear, and the difference comes in when we go over to the similar GG item. The lower body dressing does not include the footwear. But if we look at M1845, the toileting hygiene, look at that code too. It also includes, along with maintaining their toileting hygiene, oh, by the way, how are they doing with adjusting their clothing? So when you get to this item to code it for your patient, you want to be thinking back, all right, when I talked about that lower body dressing in either of these items, whether it be 1820 or the GG item, that lower body clothing that I scored this patient perhaps worse than independent on, which item of clothing was that was really the problematic piece? Was it just their footwear for M1820? Or is it more about, they're having a problem with their underoos or taking down their pants? And of course, what is involved when we toilet? That very thing. So we want to make sure that these items all kind of make sense together. Did you say they're independent in their lower body dressing, but you come to toileting hygiene and all of a sudden they're a 2? It's like, wait a minute. How is that? Is it just because of the toileting hygiene, which it could be? Or if you're saying, no, it's because of that clothing aspect, then okay, then there's something wrong with either the M1820 or that GG item. So you just want to make sure that these all kind of, speak to that same purpose. So speaking of footwear, let's get into that a little bit more. That GG 0130G lower body dressing item, right? We know what it is. And it's not like M1820 in that footwear is not considered for this lower body dressing item. What is the GG 0130H. That's talking about your footwear. Okay, and that one makes sense. Determine if the footwear is worn, and they talk about, are we talking socks, your gripper socks, slippers, or shoes, whatever they're using, are appropriate for safe mobility. So, safe mobility, let's just be sure. I said, let's say someone has, if you're in Florida and all their floors are tile, are they walking around on socks? Is that really a good idea? Or, if they're all hardwood flooring, and again, they're walking around in socks, that's pretty slippery. So is that really considered appropriate for safe mobility? And I would have to question that. Now, so what determines whether something is lower body clothing or actual footwear? So the guidance says that, whether we're talking about the clothing, the wrap, the orthotic, the prosthetic, anything that covers all or part of the foot, even if it extends up the leg like a sock or an AFO, that is footwear. So when you're looking at, can someone put their Ted hose on, right, their compression socks, that's not lower body dressing for GG. That is your GG 0130H. Footwear item. Yes, your Ted hose is your lower body dressing for the M1820, but it is not lower body dressing for GG 0130G. So again, covers all or part of the foot, even if it extends up the leg. That is footwear. Here's another one, your bathing items, the M1830 versus the GG 0130E. There's so many different variables at play here with these items, especially the M1830. So many different conditions. The M1830 delineates between your bathing conditions. Are you in a shower? Is it a tub? Or is there no shower or tub? While GG 0130, it doesn't care. All it wants to know is, okay, whenever you've planted your self down, whatever condition you are in, a tub, a shower, sitting in the bed, sitting on the commode next to the sink, they don't care. They just want to know, once you sit yourself down, how are you doing with showering and bathing yourself? That's all they care about. So it's really hard. This is really not an apples to apples comparison here. So let's look at some of those stronger considerations for the M1830 item. So we start out with the concept of, are they able to bathe in the tub or shower? And if they are, then we could have a code 2 or a 3. Obviously, I've left out the independent ones. They're pretty obvious. The 0 is, hey, I'm independent. I don't need anybody. I don't need anything to help me out. 1 is, I don't need anybody, but I need some type of assistive device, whether it's a long-handled back sponge, or I need some type of device to help me out to make sure I'm safe. It's a shower bench seat, whatever that is. That's your 0s and 1s. So your 2, now we're talking, I need a human, whether it be an intermittent supervision, cueing, reminders, or assistance to get in and out of that tub, or assistance with difficult to reach areas. You know, I can't get my feet, I can't get my back, things like that. It also includes, of course, we have to make sure we're always remembering that the M18 items always talk about your ability to get to where the task occurs. So did I need any assistance, you know, for safety reasons to be able to reach the bathroom, to get to that tub or the shower? So with this code too, so this includes the help with only one or all of the areas, as long as what the patient does not need is someone there continuously. If they do need someone there all the time, and let's think about it, that's when, you know, if you're putting a home health aide into the house for their bathing purposes, they're there all the time. This is your code 3, where they require continual verbal cueing or reminders or constant supervision throughout the bath because of physical or mental reasons. They need someone there for safety purposes. Now, if they cannot bathe in the tub or shower, then you're looking at your code 4 or 5. Whatever the reason is, they're going to be code 4 or 5. Code 4 is used if they're independent in doing this. I like to call it a bird bath. If they're independent in the bird bath, they don't need a human. So they can set everything up, they can take their own bird bath, don't need anybody around. If they do need some help with any aspect of doing that bird bath, then they would be that code 5. Code 6 is they're totally dependent in the bathing. They are not doing anything to help out. Maybe they'll lift their arms so you can wash their pits, anything like that, but someone else is doing all the work. The setting does not matter. It can occur anywhere. It can be in the shower, in the tub, sitting next to the sink. It can be a bed bath, so that the location doesn't matter. All that matters is the patient is not participating in this task. And, you know, I tried to make this, you know, table showing, okay, here's the task on the left, here's the really standout points, what M1830 is considering, and then on the right is the GG0130E. It's, you know, consideration as far as, okay, if you said this here in 1830, I would expect to see this type of code in the GG0130 item. And as you can see, it gets very gray in that area from 2 through 5 for M1830. There's just no way to do a direct one-to-one comparison. So you really, you just don't want to do that. You know, score everything on its own merits. Now let's look at M1840 and GG0170F. Both are labeled toilet transferring. So you would think they'd be, you know, a direct one-to-one. But let's remember, M1840, we also have to look at their ability to safely get to and from the toilet. And then once they get there, can they transfer on and off the toilet or the bedside commode? The GG item only talks about transferring on and off. So there's 2 components to the M1840. There's 1 component to the GG0170F item. And as you notice, the GG0170F item does not talk at all about a bedpan or urinal. So when you are coding the M1840 item, what it excludes is the assistance needed to empty the bedpan or urinal. So they talk about can they use it, but it doesn't matter if they cannot also empty it. It's just a matter of can they use it. In the absence of a toilet in the home, let's say there's some patients, maybe they don't have one, you know, you get some hoarder situations and things have happened. So what you need to determine is, are they unable to use a bedside commode or a bedpan or urinal? Or are they able to or unable to? Or if such equipment is not present in the home to allow for that assessment, that is your code 4. And this comes up most often in a total hip patient, where the provider has told them that they need to have the elevated toilet seat in order to safely sit on the commode. And it hasn't shown up yet. It is not in the home yet. You would have to put this patient as a code 4 at this time, because however it is that they're currently sitting on the commode is not a safe task for them. And that's per the provider. So like I said, if the equipment is not present in the home yet, and that's what they would need to be at that safe level, you have to mark them a 4. And hey, anywhere you go from here, when you come to outcomes, it's going to be improved, right? So code 4 is not a bad thing. M1850 and the GG items that correlate to it, because we look at M1850, it's talking about transferring, and it says the ability to move safely from the bed to the chair or ability to turn and position themselves in bed if they're bedfast. So there's lots of different tasks involved in there. And when we look over on the GG 0170 side, there isn't any one task that encompasses all of those that M1850 talks about. So M1850 actually is a roll-up of A through E. So you really need to watch, how you're answering something and making sure that you're not inadvertently tripping yourself up with something that's in direct contradiction. And the other thing is, in this transferring test, we go from someone being able to independently transfer. We obviously have an ambulatory kind of person, and then boom, in your codes 4 and 5, now we have a bedfast person. Like, well, where did they come from? So there's also different levels of mobility involved here. So we need to make sure that if we're marking someone as being bedfast in M1850, that all of a sudden when we come down to GG 0170 A through E for items D and E, all of a sudden they should not be having the ability to sit to stand or do chair, bed to chair transfers, because they're bedfast. They shouldn't be able to do those things. So this is just one of those where, if you have a scrubber, it might start screaming at you. So yeah. And again, some coding tips for the M1850 item. Your code 1 is used. It says if the patient requires minimal human assistance, and the definition per the OASIS for minimal human assistance is any combination of verbal cueing, environmental setup, and or hands-on assist. So, hands-on, hands-off, any of that would accompany minimal human assistance, as long as that hands-on is less than 25% of the total effort. So with this code 1, there's that, or the patient just requires the use of an assistive device. They don't need a human, they just need an assistive device. If they need more than that minimal human assistance, we're told then you have to go to code 2. So code 2 says if the patient requires both the minimal human assistance and an assistive device to transfer safely. Now, if they need more than minimal human assistance, you still have to stay at code 2, because they're saying, nah, we really can't push this person into a 3 for that. If you cannot bear weight or they cannot pivot safely, now you can bump them up to a code 3. And this is where people get a little squirrely. They're like, okay, I've got this ambulatory person, but what I'm saying as a clinician is when I watch them try to transfer, even with human assistance, there's nothing safe about this. That would be a code 3, which says if the patient is unable to both bear weight or pivot and is not bedfast. Because remember, in all of this, the caveat to all of these items is what can they do safely? So if you're saying that, all right, they can obviously bear weight, they're ambulatory, but when they're pivoting and they're transferring, they're just not safe. My gosh, they're just all over the boards. You know what? Then you're going to have to code them as a 3. And there's nothing wrong with that, but your documentation should really be supporting that. And this code 3, by the way, is the typical code for your Hoyer lift patient. Now your code 4 or 5, this is your bedfast patient. And so we're just looking at their ability to turn and position themselves in bed. Now let's take a look at ambulation and mobility. So M1860 versus those GG 0170 items that correlate, just like the M1850. There's one of it, and then there's several of the GG 0170s that make up that one task. So let's just look on the M1860, the ambulatory, the walking codes. So that's 0 through 3. And as you notice, one of the caveats for M1860 is there's no distance or stair quantity requirement. It's just, can you do it? And what they talk about, really the underlying reasoning for the ambulatory is, we're talking at least more than 4 or 5 steps. If the patient can only do that, that's really not considered a functional ambulator. But more than 4 or 5 steps, now you're a functional ambulatory person. However bad that may look, you're still considered ambulatory, as opposed to just doing a multi-step transfer. Then For those, just the 0 through 3 coding there will be, kind of quote unquote, I'm using air quotes here, comparing them to the GG01C I through O, which is your walking and your steps that make up all those same tasks up in the M18 item. And as you can see, that code 2, which talks about the very end about, being on uneven surfaces, that comes in for that code L, for that item L in the GG0170. So there is some comparison there, that there are uneven surfaces talked about in both sets of items. Now, if you have someone that they're, not even safe with assistance, but there's no wheelchair in the home yet. So how do we code M1860? Because we know there is no item that says, hey, they're up and they're ambulating, but they're really, I don't recommend it for them, but there's no wheelchair in the house. How do I code this person? So we say, even with the assistance of 1 or 2 people, if documentation does not demonstrate safe ambulation, they can't be coded as a 3, right? Because code 3 says with assistance, they are safe. You're like, well, wait, they're not. And this is the kind of patient that I've always referred to as, you want to call that dragulation or ambudrag, where the helpers are really doing all the work and the patient's just kind of going along for the ride. So they would have to be coded as a 4 or a 5 for that M1860, dependent on the availability of a wheelchair and their ability to maneuver it. Okay, so if there is no wheelchair available, the default code is 5, right? Obviously, you can't mark them as 6. They're not bedfast. So the default code is 5 for those that do not have a wheelchair in the home. So again, nothing wrong with that. Your documentation is going to support that they are not a safe ambulator, even with the assistance of 1 or 2 people. So you get a wheelchair in the home and you get them better, they're able to self-maneuver a wheelchair. That's going to show an improvement in your outcomes. Or even better, maybe you can get them to the point where they can demonstrate safe ambulation for even a short distance, and even better. Now, what if they're not ambulatory? So now they're in a wheelchair. The M1860 wheelchair items, your codes 4 or 5, there is no distance or turning requirements. It's just about, can you self-propel it or not? And if you are propelling your wheelchair, can you do it safely? Remember, it's all about safely. So when you're out there, you want to take a look, have they redecorated the door frames? How's their drywall right above, where the foot pedal is? So you just want to make sure, are they safe in their ambulation? Their mobility. I can still remember a patient of mine that had a power wheelchair that she just about ran me over. Vision wasn't the best. So yeah, and of course we had to turn her speed way down into the turtle zone. And then on the corresponding side for the GG0170 items, we have Q through SS1, all about the wheelchair. So do they have a wheelchair? What type is it? Can they go 50 feet with however many turns? Can they go 150 feet? So there's different requirements there. And again, the M1860 item has no such requirements. It's just about, can they maneuver it safely by themselves, or do they need help? And then finally, on M1860, we have the bedfast item, which is your code 6. And what that encompasses on the GG0170 side is your A through C, which is, technically the bed mobility items. Look at that, rolling, sit to lying, and lying to sit. And we also want to consider, when we're looking at this item, did we code appropriately when we answered M1850, the transferring item? Remember, those codes 4 and 5 are your bedfast items. So let's make sure we're keeping bedfast consistent throughout this oasis. And just a reminder, bedfast means they're confined to the bed due to medical restriction or are unable to tolerate being out of bed. So someone who spends their time in a bed but is Hoyer lifted out into a wheelchair or into the recliner to enjoy, the sunshine out in the living room, that is not a bedfast patient. That is a chair-fast patient, most likely, but that's not bedfast. Bedfast means you're not getting out of that bed because either the doctor said it's not in your best interest. It could be one of those, you go to sit them up and the blood pressure plummets, or, their feet suddenly, go dark. There's some type of circulatory issue. So they're bedfast. There's a medical restriction, or they just cannot tolerate being up in a chair. So the GG 0170 A through C items, just a reminder, we have your rolling, your sitting, back and forth conditions there. And just something else to consider, M1860. So you said they were bedfast. Let's just take a look at these GG items. 0170 D to G. We've got sit to stand, chair, bed to chair transfer, toilet transfers, car transfers. Now wait a minute. If you said in M1860 they're bedfast and this patient is truly bedfast, you got that part, absolutely correct, then when you're coding these items, they really shouldn't be in that 01 through 06, dependent to independent range. They should probably be either an 09, we're not doing it now, we've never done it before, or some other activity not attempted code. Because remember, they're bedfast. They shouldn't be doing toilet transfers or car transfers or sit to stand for sure. So again, there's moving parts, and just, make sure when you're looking at your patient's scores, they make sense together. This is a slide I set up years ago regarding M1870. On the left, this is not meal setup. It's just good service. Someone's bringing you food. They made your sandwich for you. They're bringing it to you. That's not meal setup. It's just good service. Meal setup is this lovely gentleman on the right cutting up all the food for his wife there in the hospital. So, if anyone had any children, what did you do for your toddlers? You're cutting up the food, making it all bite-sized. Did you have to puree something? Do you have to put the the milk into the coffee? All that is meal setup, which of course leads into the M1870 items. So M1870, your feeding or eating, is similar but not identical at all to GG 0130A eating. All right, there's definitely a component of M1870 that is the same as the GG 0130A, but then after code 3 through 5, it's 100% different. So when we look at this, in M1870, your code 1 encompasses 3 different concepts in there. It said they're able to feed themselves independently, but they require either meal setup. Remember what that meal setup is, mashing potatoes, cutting food up, blah, 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 or the intermittent assistance or supervision from someone else, or a liquid pureed or ground meat diet. So any of that would say, I need to be score 1. If we look down on the GG 0130 item, for the eating, this is the able to use suitable utensils to bring the food and or liquid to the mouth, right? So once the food is put in front of me, how am I doing with feeding myself is really what you're thinking about. So that meal setup that you're thinking about that the patient needed back in M1870, that's going to be your code 05 for the GG 0130A. That's your setup, right? It's something that's done for the patient before they get to that task of eating or feeding themselves. So that's where that comes in. That's what that little 05 with the arrows is. If I'm putting 05 here, I'm really referring to that meal setup in the code 1 for M1870. But then we look down on M1870 through the 3 through 5, and here we're looking at tubes, NG tubes, PEG tubes, or your IV devices, your TPNs for that score 5 there, right? Those don't exist in the GG 0130A eating item. Okay, they're just not part of that. So if you have someone that's strictly, on a PEG, like code 4, your eating is probably going to be either an 09 or some other, code, but it's not going to be, oh yeah, and I'm also eating independently. You can't. Not if you're on a PEG with they're on an NPO diet. Just a reminder, the process for answering GG items is basically, it's the same. You really want that same process running through your head on all these items. First, the question is, did the activity get done? And if not, enter the appropriate reason not attempted code, whatever's going on. From there, if the activity got done, how much assistance was needed? And assistance, I mean people. With that human, how much assistance was needed from that human? And you take that assistance from the human and you match the performance code. That's basically, a pretty simple process, and that's just the process you want thinking when you're answering all these GG items, did the activity get done? How much assistance was needed by a human? And match that performance code. So I did some digging around in the charts, and I found some to throw some comparisons up, things to look at, points to ponder. So on this one, I pulled out the GG item for showering and bathing, and it was coded as a 04, which is your standby or contact guard assistant. So a human is needed, right? But on the corresponding M1830 bathing item, it was marked as a 1, which says with the use of devices, they're able to shower independently, including getting in and out of the tub or shower, which is no human. All right, and if we use therapy speak here, that's your mod independent patient. Modified independent is they can do it by themselves, they don't need a human, but they need some type of device, and that's that code 1 for this item. So these two items do not correlate. You can't say in one they need a human, which is that code 04, and then say in M1830 they don't need a human. All right, and just as an aside, all of the other M18 and GG items were marked as independent. So that code 04 is the anomaly here, and we'd have to get that corrected and really seriously looked at. Either the 4 is wrong or the M1830 item is wrong. But without looking at other documentation, there's no way to know right now which one is incorrect, but this is definitely something, if you either had a scrubber or you're using us for reviewing, that's going to get flagged. Say this is not making sense together. One of those is wrong. So I ran through another chart, and I just came up with this table showing on the left and then the third column to the right, the M18 and the corresponding GG items that make it up, and putting what it was coded as for the M18 and then what it was coded as for the GG items. And these all actually look good together. The only comment I would make for the dressing items is dependent on what that help actually consisted of, where it says someone must help, the corresponding GG items might be coded at a higher assist level. It all depends, it could be, because remember, on the M18 and M1820, we're looking at majority of the task majority of the time, whereas in the GG items, we're only looking at the whole task in its entirety and what's the percentage of assist needed there. So contact guard assist or someone must help, the standby assist, might actually be that code 2. So, on its face value, I'd say there's nothing wrong with this coding. Everything makes sense together. But just to be sure, I would have to do a deeper dive, see if this OT was out there and what did that dressing actually look at, just to make sure that those GG items were scored appropriately, or did they maybe need to be scored a little more stricter, like maybe down into the 03 for partial mod assist. But otherwise, this looks great together. So I buttered you up to get to this one. No kidding. All right, so did the same thing again, pulled another chart. And what my color coding means is just these items, compare against each other as opposed to, the yellow, which is just staying within that item. Because remember, we're looking at, there's some tasks in theory that overlap. 1840, there's components of that with the ambulation. It talks about the transferring, and which is access to. So getting to where the toilet is involves ambulation. So sometimes there's going to be some overlap there. So M1840, we had a 1, which is your verbal cueing, contact guard, or standby assist to get to and from or stand up and down from the toilet. And then we had in ambulation 3, assist needed. Okay, that's your typical ambulator that maybe has a falls risk. Then we look over at the GG 0170 items, and it was coded as an 09 NA, which means didn't do it before, not doing it now, which is all your ambulatory items. That does not make sense. So clearly, I believe that those 09s were, I'm just going to say a miss key. So that's definitely something that's going to get flagged. Down the M1870, the feeding, it was coded as a 2, unable to feed themselves, assist or standby assist needed throughout. But yet on the GG 0130A item for feeding, it was marked as independent. Something's wrong there. And again, that would take a deeper dive into the documentation to see which one of those is off the mark. Just looking at it, you can't say, well, because they put an independent in GG0138, let's just change the M1870 item. No, it could be M1870 is scored correctly and the GG0130 needs a deeper look into what is going on. So clearly those two do not belong together on the same chart. So something was miskeyed somewhere. And same thing on this item. Everything else looks good. We have a very independent person, except for the bathing, where it was marked on the M1830 side, independent using an assisted device. So that's your mod independent patient. But on the showering bathing for GG0130E, it was marked as standby assist or contact guard assist. Again, you can't do that. You either need a human or you don't. So again, one of those is miskeyed. So, I've gone through all of the M18 and the GG items, trying to show what are really the strong points, the things that make these items what they are. What you really want to look at was that hidden concept below each item so that you're scoring them appropriately for your patients. And also showing like almost the hidden, if you have a mechanical scrubber such as HHP, or if you're using someone in your office for quality control, or you're using outsourcing to do your scrubbing, and any of those methods is fine. Just this is what is being looked at. They're trying to compare these apples to oranges and making sure that the fruit basket looks correct and how everything is being coded. And so we just want to be sure that when the clinicians are coding on their side, that they're really understanding those nuances and seeing where, the OASIS really can trip you up without really realizing what's going on. So best of luck. And if you have any questions, I can be reached at my email address. We also have a new director of education that has arrived, Heather Curran. She's also excellent in OASIS, so she can be reached as well, but we're just here to help you out. Good luck.